I'll be starting a series of cases that pertain to patients who have had profound impact in me as a person, as a surgeon. So my first case, this gentleman was, I believe, in his late 60s. He was walking with his wife on the sidewalk, and the area had snowed recently, and he slipped and fell and became paralyzed. This gentleman was a CPA, a high-functioning individual, and he had what's called underlying congenital cervical stenosis and undiagnosed cervical spinal cord compression. What that simply means is sometimes patients have severe spinal cord compression in the neck, but they're completely asymptomatic. So when they're asymptomatic, they're not going to ask for help. They're not going to go see a surgeon. They're not going to go see their doctor. But in his situation, he had an undiagnosed spinal cord compression, which in his setting, even the slightest trauma could result in severe sort of a deficit, which is, in his situation, resulted in quadriplegia, which means he was paralyzed in his arms and legs. So things that are considered warning signs for patients who have this condition: neck pain, intermittent numbness and tingling in the arms, occasionally when you're holding on to something and you just drop it and it falls, sometimes having balance difficulty. If you have any of these, I would definitely get checked out. It's so important. By missing something like this, you can have a permanent deficit that may not be fixed with surgery. And in cases where patients who have similar conditions, even a slight fender bender, like a minor accident, can result in this deficit. So get checked out if you have any of these symptoms.